A 56 years old female patient presenting with trauma with an elastic cloth line. In this patient, the scleral rupture repair was done earlier. While doing the surgery, vitrectomy was done. And after clearing the vitreous hemorrhage, vitreous incarceration was seen in the supertemporal quadrant along with retinal incarceration. To free the retina, localized retinectomy was done. Followed by air fluid exchange. Then endolaser was done to secure the retina. And silicone oil injected. After 3 months, silicone oil was removed in this patient. And scleral fixated IL was done. This is a case of a 36 years old male patient presenting with diminution of vision in the right eye followed by a trauma with a motor blade 3 months back. A large macular hole with perimacular subretinal hemorrhage was seen. While doing the surgery, PVD was induced with the help of triamcinolone and BBG dye injected. A large ILM peeling was done with the help of inverse flap technique. Followed by air fluid exchange, and then gas was injected. This is a 15 years old boy referred to me as a case of dropped cortical matter, who was earlier being operated for post-traumatic cataract. On examination, a small yellowish elevation was seen in the infranasal quadrant, so a foreign body was suspected. PVD induction was done with the help of triamcinolone. Capsule around the foreign body was removed. Foreign body was freed from the retina and then it was removed with the help of an intraocular magnet. Then endolaser was done around the site of foreign body, followed by air fluid exchange, and silicone oil was injected. A 16 years old boy presenting with diminution of vision in the right eye, which was noted incidentally 10 days back. The boy also gives a history of trauma 1 year back. While doing the surgery after PVD induction, subretinal bands were removed with max grip forceps. Then PFCL was injected. While injecting PFCL, it went subretinal. So I decided to do a 360-degree retinectomy. So 360-degree diathermy was done, followed by a retinectomy. Subretinal bands were removed. Retina settled with the help of PFCL. and PFCL oil exchange was done. A 12-year-old boy presenting with a history of firecracker injury 3 months back. The patient presented with corneal opacity, a self-absorbed lens matter and vitreous hemorrhage. After clearing the remnants of the lens, vitrectomy was done. Then a localized retinal incarceration was seen in the supertemporal quadrant along the supertemporal arcade. ERM peeling was done around it. Followed by a air fluid exchange, and silicone oil was injected.